So I'm going to be talking today about a comparison of total knee arthroplasty outcomes between hemodialysis patients and renal transplant patients. We have no disclosures. The purpose of this study was to compare the relative postoperative outcomes between hemodialysis patients and renal transplant patients after total knee arthroplasty to better understand the ideal timing for total knee arthroplasty in the end-stage renal disease population. This was a retrospective cohort study of the National Readmissions Database using ICD-9 and 10 codes. We identified these patients who underwent total knee arthroplasty from 2010 to 2018. Our primary outcome was in-hospital mortality. We also looked at 90-day medical and surgical complications, readmission rates, and utilization outcomes. In terms of statistics, we used univariate analysis with Wald and chi-square test and multivariate logistic and linear regression. For baseline characteristics, we had 61% hemodialysis patients and 39% renal transplant patients. The hemodialysis patients were significantly older, more likely to have Medicare insurance, less likely to have their surgery done at an urban teaching hospital, and had a higher relative comorbidity burden. In terms of medical complications at index hospitalization, hemodialysis patients had a higher odds of mortality, any complication, cardiopulmonary complications, sepsis, and need for a blood transfusion. At 90-day readmission, the hemodialysis cohort had a higher rate of PJI and surgical site infection. When looking at a regression model for cost, utilization, and quality outcomes, the hemodialysis group also had a higher rate of 90-day and 30-day readmission, higher rate of non-home discharge, increased hospital costs, and length of stay. In terms of limitations, this is a retrospective study. There's limitations inherent to database studies, short-term results. There may be confounding due to individual surgeon technique in different perioperative protocols. But in conclusion, hemodialysis patients have an increased risk of mortality and complications after total knee arthroplasty when compared to renal transplant patients. They're a high-risk population and warrant careful perioperative optimization and monitoring. And consideration may be given to delaying total knee arthroplasty in hemodialysis patients until after they've undergone a renal transplant. Thank you for your attention.